And new tonight, overwhelmed and understaffed local emergency rooms are struggling to keep up with patients. Austin is seeing a steeper than ever COVID-19 surge. This graph we created shows a near vertical spike in hospitalizations. They're up actually 40% since the beginning of the month. KXAN's Jennifer Sanders sat down with a doctor on the front lines to see how these numbers are playing out in real life.
A plea tweeted out from St. David's Healthcare Friday urging the public to reserve emergency rooms for emergencies, not for COVID-19 testing. KXAN spent the day calling emergency room doctors across Central Texas. Overwhelmed and inundated were the two words nearly all of them use to describe their current situation.
People are having trouble finding testing at the stores, for rapid testing. So they're going to our ERs and getting tested.
Dr. Guadalupe Zamora is with Texas Medical Association. He's treating patients outdoors if they show COVID-19 symptoms. Just before Christmas, he was seeing one or two outside. This week, that changed.
I saw 37 patients myself, and a third of them were positive.
KXAN has been tracking data since the beginning of the pandemic. Dr. Zamora walked us through this community transmission rate graph, which starts last March and takes us to this week, the highest point.
We're going to even see larger numbers than last year. Those peaks are going to continue to get bigger and bigger. The peaks are larger than last year.
UT researchers told KXAN Friday that projections show our peak in cases could come in the next few days.
When we have a peak of cases, then we have to wait some time before these people get hospitalized, and again a few times before we have some death.
We're going to exhaust our staff there at the hospital. We may need to go to a transitional center.
In Austin, Jennifer Sanders, KXAN News.
Hospitals like Ascension, Seton, Baylor, Scott and White, and St. David's have a surge plan in place that includes using all available patient care space within their hospitals and in other settings across local healthcare systems. They are continuing to work with Austin Public Health to develop an alternate care site that would be ready to open if needed.